In this case, we have a patient with more moderate symptoms than the first, and she doesn't respond well to the initial treatment. Although it's appropriate to refer this patient to a gastroenterologist who can coordinate multidisciplinary treatment, we wanted to consider how this patient could be approached, either after an initial consultation with gastroenterology or, as in this case, entirely in the primary care setting, since waiting for a referral would delay her treatment. As a GI consultation is not immediately available, she has already escalated amitriptyline without satisfactory improvement, and symptoms of bloating, pain, and diarrhea persist. A reasonable next step would be to switch to a different agent. In this case, ulaxatiline 100 milligrams BID should reduce these symptoms, but be sure to ask about any history of pancreatitis, biliary disorders, and quantify alcohol intake. Or a 14-day course of rifaximin is another effective treatment for reducing bloating and IBS symptoms. I'd continue FODMAP. If she hasn't seen a dietitian yet, I would encourage her to. Higher doses of loperamide or the addition of bile acid binding agents may aggravate bloating and other symptoms, so neither would be on my first choice at this time. So, how do you decide that the patient hasn't responded to treatment, and when should you consider changing your approach? I rely on patients' input as to whether or not the plan has worked. To help with that, I invite all patients to keep a simple Bristol stool scale and GI symptom diary for a few weeks after any therapy change, and again a few weeks before they return to clinic. Symptom data is better than recall and can be a useful guide to making therapy decisions. There are instances where every effort should be made to have a patient evaluated and at least initially treated by a specialist. If the patient has alarm symptoms, see Table 2, symptoms are not improving with stepwise care, or are worsening, I'd recommend calling the gastroenterologist's office and requesting an early appointment, or asking them advice until the patient could be seen.